Chairman. I do agree with you that China is not our friend, but however, it's hard to take this administration seriously on this issue when they are firing hardworking public servants who support generic drug approvals, facility inspections, and initiatives that help companies make the products in America, because that will just cause a longer delay. I do want to say the COVID-19 pandemic laid bare the challenges of our medical supply chain. But unfortunately, Mr. Chairman, as you mentioned, our reliance on foreign supply chains for critical medical products has been a problem for decades, as you said, much longer since 2020. We have a system that's great at producing cheap generic drugs and basic supplies, but we do not have a system that's great at encouraging a resilient supply chain that we can always count on. I believe everybody in this room wants to be serious and come up with serious solutions to ensure a secure, reliable medical supply chain. During the COVID pandemic, everybody in the world needed the same products at the same time, and manufacturing was severely disrupted. That put the problems with COVID put this problem into sharp relief because there were too many single points of failure. There was an inability to quickly shift manufacturing to critical products, and there were, as you said, there was an over-reliance on unreliable foreign countries among them. That has all been long simmering. So I think it's past time we work together to stop the endless cycle of shortages of critical medicines and ensure that we will have a reliable supply of medical products. This committee considered legislation last Congress to address the supply chain and how it relates to drug shortages. This includes legislation from the former chairwoman of this subcommittee, my predecessor, Anna Eshoo, to ensure that we better understand where the active ingredients for these drugs are coming from. The bill, the Drug Origin Transparency Act, is so important because only 12% of active pharmaceutical ingredients globally are made in the United States. We also, of course, need to reauthorize the Pandemic and All Hazards Preparedness Act, one of the major tools we have to invest domestically in medical countermeasures. Some PAPA authorized programs like the Biomedical Advanced Research and Development Agency have made it possible for innovative manufacturers to help the American people prepare for public health emergencies. And I know I have friends on the other side of the aisle who are working very closely to try to get this PAPA reauthorization into this committee for hearing and markup and onto the floor. And the Strategic National Stockpile can be used to help support domestic manufacturers and secure the supply chain by focusing on resiliency. Our hospitals can also be part of the solution. Hospitals are major medical supplies purchasers, and they need to be at the table to encourage and reward domestic production and secure supply chains. But frankly, as I mentioned, I'm troubled by the discordance between this committee's other work this Congress and our work today on supply chains. For example, the more we squeeze hospitals, particularly rural hospitals, the less they will be able to do to spend a few extra dollars on Buy American. If we kick off millions of people from Medicaid under the Republicans' reconciliation bill, that will result in an additional $42.4 billion in hospital uncompensated care costs in 2034. Let me say that again. If this bill actually passed the way it passed from this committee in the House, there would be an additional $42.4 billion in hospital uncompensated care costs in 2034. That would translate into hundreds of billions of dollars of care hospitals who will have to swallow in the next 10 years. I don't think that that's going to make hospital procurement offices more able to consider the source of the antibiotics they're buying. Instead, what it does is it makes them even more likely to go with the cheapest option, regardless of where it came from or any downstream consequences. So I implore my Republican colleagues to consider all of the consequences of their Medicaid cuts, not just throwing 16 or however many people off of health care. A resilient supply chain will become less popular as we squeeze care for hardworking Americans, and especially rural and otherwise under-resourced hospitals that provide us with that care. So I want to thank you again for Mr. Chairman for having this hearing, and I will yield back.
The gentlelady yields.